workshop on services and care, issues of access to health and medical care to Puerto Rican and Latinx people as part of the Puerto Rican Health Summit. In today's workshop, we will discuss a variety of challenges Puerto Rican and Latinx people face in accessing and receiving quality health and medical care in the United States, particularly in the Chicago area. This is an important topic to discuss because Latinx people are more likely to not have a regular medical home or source of care, not have health insurance or be underinsured, face linguistic or cultural barriers with health services, and experience barriers to care within the health system, such as scheduling difficulties or long wait times. Over the next hour, our esteemed panelists will share more details about these barriers and discuss proposed solutions and recommendations that advance health equity for Puerto Rican and Latinx communities. I will be your moderator today. My name is Shannon Russell. I'm a senior consultant at Slalom, a global consulting company with a local delivery model focused on strategy, technology, and business transformation. My academic and professional background has been devoted to the healthcare industry, and my passion area is patient experience, health equity, and social determinants of health. I'm honored to be a part of the Puerto Rican Health Summit and introduce our speakers, who will each share a bit about the important work that they do in addressing barriers to care. Then we'll all come together for a question and answer session. Up first, I'm honored to introduce Marta Cerda. Marta is a JD as well as the CEO of ASI and Northeast Health Services, a one-stop shop for helping people age well at home. ASI is one of the largest and oldest Latino-led not-for-profits in Chicago, and Marta led ASI's expansion with the creation of for-profit Northeast Healthcare Services Incorporated. Together, they offer home-based medical, behavioral, and telehealth services, as well as transportation, insurance navigation, patient sitters, and most recently, a vaccination site for COVID-19. Prior to starting ASI in Northeast, Marta was the chair of Norwegian American Hospital's Board of Trustees, one of few Latinas in the state of Illinois to hold such a position. She was also the chair of the Governance Committee and CEO Search Committee. Marta is a recognized thought leader in the areas of healthcare, population health, aging populations, and workforce development. So much so that she was recognized by Crain's Chicago as a notable woman in healthcare this past year. Next, I'd like to introduce Jessica Torres from Blue Cross Blue Shield. Jessica is a public health professional from the southwest side of Chicago. At Blue Cross Blue Shield, she is the manager of health education at the Blue Door Neighborhood Center in South Lawndale. Jessica graduated from the University of Illinois at Chicago with a Master's of Public Health degree and a concentration in health policy and administration. She is also an alumna of Chicago United for Equity and the New Leaders Council Fellowship programs. Her work is rooted in health equity, leveraging resources into historically underserved communities and ensuring culturally and linguistically appropriate health education material is available to Latinx populations throughout Chicago. Last but certainly not least, I'm happy to introduce David Thompson and Elisa Rios, your local Cigna Medicare advisors. Elisa also speaks Spanish. David and Elisa offer 3 essential opportunities to those that are either on or close to being eligible for Medicare. The first is Healthier Together, a health and wellness educational series that addresses individual topics such as flu and pneumonia, practical nutrition, fall prevention, diabetes, and much more. Second is Benefits Checkup, an online tool which helps identify local public and private programs for which you may qualify. Assistance programs include medication, healthcare, food and nutrition, transportation, tax relief, veteran services, and so much more. And the third is Medicare education and guidance, plan details, and information on applying for extra help, the low-income subsidy for saving money on prescription drug costs. Cigna offers all of these programs at no cost to you, and as your local Cigna Medicare advisors, David and Elisa's goal is to help support you living a healthy life and be your trusted Medicare advisors. Up next, I will invite each of our speakers to share more about their work and insights on the challenges Puerto Rican and Latinx communities face in access to health and medical care. First, I'm happy to turn it over to Marta.
Thank you, Shannon. Thank you so much for the wonderful introduction. And I just wanted to further frame the issues facing our Latino elderly population. So you may start with the first slide, Evan. So we, as Shannon mentioned, we do have many healthcare disparities that impact our Puerto Rican community. And in particular, our Puerto Rican elderly have high rates of diabetes. This is due to our high rates of obesity. And the Puerto Rican agenda itself found a few years ago that 72% of Humboldt Park adults were obese. We also have high levels of poverty, which in Humboldt Park, the current unemployment rate is 8.8%. So all of this is negatively affecting our Puerto Rican elderly. Also, our Latino elderly are diagnosed earlier with Alzheimer's and dementia. This more so than the general population. And Puerto Ricans have high rates of depression, especially among Puerto Rican elderly women. Next slide. So this is important and to address because Latinos have one of the most vulnerable populations in the country, and we are the fastest growing population segment of the elderly population of our country. And I have to say, in doing research, it was really challenging to find more research on Latino elderly in particular. So that's an area that we do recommend there's more research done to help to improve the health of our elderly growing population. Now, as has been mentioned, there is a lack of knowledge of services. For example, 55% of our uninsured Latinos don't even know about the Affordable Care Act. That is a problem. And we also, and importantly, I wanted to highlight, we lack clinicians with an understanding of our culture and our beliefs. For example, among our Puerto Rican culture, familialismo is important to us. Our family is more important than our individual self. And so it's really important to have clinicians who understand this. For example, my mother went for care for her dementia at a major hospital, and she found those clinicians to be super cold. They didn't understand her culture. She's very Puerto Rican. And so then we couldn't even get her, no matter what we did, to go back for additional care. That's a problem because she needed this help. And this is what the problem is when you don't have clinicians who are culturally sensitive. And we have too few Latino healthcare professionals, a major issue. Next slide. So, and then as has Shannon just mentioned, 17.5% of Latinos do not have a primary care physician or a medical home. Now, our home health nurses found this out because they would get patients discharged from hospitals and they would not have a physician, a home, and some of them didn't have a home. So, and most of our people do go to community hospitals and clinics. And what happens is that you have a lack of continuity of care. There's no one really tracking, and there are gaps, and this can result in poor health care. And again, I just want to emphasize again, not only is there a limited sense of cultural sensitivity, but we have to have more materials in our languages and an increase in health literacy. Next, I wanted to highlight health inequities. Health inequities related to socioeconomic status, cultural background, and unemployment are a big issue for our community. And as I mentioned before, the Humboldt Park community, Puerto Rican community suffers a lot from unemployment. So to my recommendations. First, I have 5 and a few more a little bit later, but we believe it is super important to support community organizations to enroll Latinos in a culturally appropriate way to avail and link them to available health coverage programs. For example, here at ASI, we have a senior health insurance program counselor who provides that assistance. Second, we need to increase funding for Promotores de Salud, community health workers who are out in the community, going into the workplace where our community members are, to give them information on healthcare resources and other resources available in the community. Definitely, we need to increase this. Third, we need to have more coalitions. These are collaborations between state and local governments, universities, clinics, FQHCs, and community-based organizations. I am happy to say in Illinois, we have created Illinois Unidos. This is a coalition of physicians, clinics, nurses, hospitals, elected officials who actually attend our meetings. And we have been working together, and we meet on a bi-weekly basis to tackle COVID-19. We recommend that more models like this be replicated throughout the country. Fourth, there's a need to increase educational resources to increase the number of Latino physicians, registered nurses, and entry-level positions. And last, we need to develop cultural sensitivity in the healthcare workforce. Super important, because as I said, you have that negative impact, and then that patient does not receive the care they need. Now, as Shannon mentioned, ASI is a one-stop shop for healthcare in the home. We are Latino-led. I am Puerto Rican and Mexican. Our nurses who lead our home health agency are Puerto Rican. And our whole workforce is 60% Latino. So we have, the medical home care, the non-medical home care, behavioral health, which is super important. And we have telehealth, which is a way we can reach into the home to better track care. And we actually transition patients from hospital into the home to close some of these gaps in continuity of care that can lead to mistakes and problems in healthcare. So that's super important. Next slide. Because improving access to healthcare is so important to our mission, we are building a new center, which is a new post-acute care and training institute. Next slide. Health equity is the core of our mission. We want to help to remove obstacles to care, including poverty and access to education. Next slide. Our center is going to be pretty close in the Humboldt Park community, and that's important to, Evan, you can go to the next slide. Sorry, thank you. So our new center is going to be pretty close to the Humboldt Park community. It's a comprehensive center from a community-based organization for our community. And it will have multicultural training for healthcare entry-level positions. And it will have, for example, Promotores de Salud. We're going to be having training for that at our center. And we're going to be helping the unemployed to access employment resources. Because again, the rates of unemployment are very, very high, and this hits upon healthcare. Next slide. We really hope that our new center will be an anchor for urban revitalization and help to promote economic development and community vitality and help to improve the health of those we serve. Next slide. So again, this is tackling a key social determinant of health, unemployment. If you are not employed, how then too do you access healthcare, housing, really, you have to tackle that as one of the key ones. And that's what we will be doing in our new center, where we are developing new partnerships to help strengthen the work that we're doing. And I should note that St. Augustine College, a community-based college that is Latino-led, is a key partner for us, as well as we're welcoming other partners like a hospital and others to join in the development of our services for the community. I just key out because, again, with unemployment, I did want to note that can lead to depression, low self-esteem, and physical pain. So it's really, really important. And I have to say, especially during this pandemic, depression, mental health issues have been growing. And so that's an area that we also need to tackle. As we said, Puerto Rican elderly women suffer more from depression. So our behavioral health services are going to be important toward that. Next slide. So filling skill gaps and growing the need is super important. Our facility is going to be around 15,000 square feet. Again, a model of our healthcare, our unemployment care, a whole training institute with partners like St. Augustine College, all working together to get increased access to our healthcare services in the home, increase access to training so we can get more people on the ground who are culturally sensitive, and hopefully increase the number of Latinos who are in those positions. We're going to have a CNA, Certified Nurse Assistant training program, for example. We just need to get to really tackle this issue to improve the health of our Puerto Rican elderly community. So I did want to say this again, this is a partnership with St. Augustine College. Skill building is what we're going to be doing. The more people who have skill certifications, the more people who will be employed. Finally here, there's going to be a huge community impact to this building. We're expecting over 15,000 to get our employment resources alone. And I did want to note that our caregivers are giving care in a culturally sensitive way. So right now during the pandemic and throughout the pandemic, they have been out there taking care of our clients, providing them with medications and care and compassion and helping them in a culturally sensitive way. They note any problems they have so we can have those problems addressed before anything happens. So post-acute care is now moved to the forefront of the healthcare industry. And that's why it's important that we build this new model within our new center to tackle the care of those who are over 65 years of age, in particular for our post-acute care. So with that, that covers our work to help improve access to Latino elderly. Shannon.
Marta, thank you for sharing. Your organization does so much for the community. And I also want to thank you for highlighting the importance of behavioral health in addressing the prevalence of depression and the important role that a community healthcare worker plays, such as you mentioned the Promotores de Salud, in smoothing over the gaps with the continuum of care and enhancing health literacy. So thank you for the work that your organization does.
Thank you, Shannon.
Next, let's hear from Jessica Torres and the work that you do at the neighborhood center, or the Blue Door Neighborhood Center in South Lawndale.
Great. Sorry, are you able to see my screen?
Yes, we can.
Yes, okay, great. So let me just start it from. Oops. All right. So thank you, Shannon, for the introduction, and thank you, Marta, for using your first few slides to really frame the importance of all of our work in trying to increase access to care in the Latinx population. So my name is Jessica Torres, and I'm the manager of health education at the Blue Door Neighborhood Center in South Lawndale. Today, I'll be sharing some information on the Blue Door Neighborhood Centers and our work to improve community health and health equity throughout the city of Chicago and the state of Illinois. So the Blue Door Neighborhood Center is the first community-based health and wellness center on behalf of Blue Cross Blue Shield of Illinois. At Blue Cross Blue Shield Illinois, our work's purpose is to do everything in our power to stand with our members in sickness and in health. We fulfill this purpose by practicing the values of integrity, respect, commitment, and caring and excellence. And we carry these values in the work that we do every day at the Blue Door Neighborhood Center. So what is the Blue Door Neighborhood Center? So I'll refer to it as BDNC throughout my presentation as it's a lengthy name. So BDNC is a space where individuals can learn, connect, and focus on their health in their own communities. So the center is not a clinic, and we don't provide clinical health services, but we are a place where individuals can attend classes, health education workshops, and get access to community resources. So BDNC is a brick and mortar health and wellness center with the goal of improving health and empowering individuals to make a difference in their own health. So we do this through a number of initiatives, including care coordination, free health education and wellness programming, linking individuals to resources in their community, and offering a no-cost meeting space to our nonprofit partners. So in this slide, I'll talk a little bit about our care coordination and community linkage, and then I'll dive into our programming efforts in the next slide. So specifically for Blue Cross Blue Shield and Medicaid members, we do offer care coordination services at the Blue Door Neighborhood Center. And so this allows a Blue Cross member to work with a care coordinator one-on-one to identify their specific health needs and goals. These two individuals then work together to really achieve the desired health goal. And this is also something that Marta mentioned, and I agree with you completely. We need to fund care coordination services, and we need to have more care coordinators and promotoras de salud, because they really are they're a missing link in the healthcare system right now. So thank you for saying that. And then in terms of linking individuals to resources in the community, at BDNC, we believe in addressing whole person health and holistic health, right? So that means more than providing health and wellness programming. It means understanding the social determinants of health that affect our access to care. And so we really work with community-based organizations to establish relationships with those trusted partners so that we can link our members and our community members to those resources when it's presented that there is a need. So an example of this is we'll offer a class called like Navigating Local Food Resources. And so we make relationships with the Greater Chicago Food Depository and local food dispensaries so we can help individuals learn how to locate food pantries within their neighborhood and then know when and where they can access them. So now I'll speak to our BDNC programming. So on this side, I'll focus specifically on our health and wellness programming, which I'll mention all of it is free and accessible to all individuals. So you don't have to be a Blue Cross Blue Shield member or even live in the city of Chicago now that we're virtual in COVID. This is accessible to everybody really across the United States. So at BDNC, we design our programs using a three-pronged approach, which includes condition management, health promotion, and social determinants of health. So with condition management, we really like to partner with licensed health professionals who can provide education on condition management, right? So a licensed professional that can answer questions that I myself am not licensed to do, and really just be able to get in front of somebody who can answer questions that maybe they didn't have the opportunity, excuse me, to ask, you know, at their doctor's appointment, or maybe they were too shy to ask at their doctor's appointment. And with these health professionals, we really try to find a local physician. So somebody that works in the community that we're serving, because they really have an understanding of the health needs that that community is facing. With health promotion, with our health promotion programming, this is really facilitated by our internal health education team. And this education focuses on how to prevent chronic conditions, increase health literacy, awareness, and knowledge. So an example of something like this would be like understanding my plate, or tips to lower sodium consumption, or learning how to cope with stress. And so we understand that chronic illnesses are a major concern for the communities that we serve. And we want to be able to provide that health education in a culturally relevant and linguistic, in a manner that our patients understand, right? So it really involves looking at the information, the guidance that is put out by federal agencies, and then working to adapt that into language and present it to our community members in a way that will resonate with them. And then lastly, our social determinants of health programming. So again, at Blue Door Neighborhood Center, we understand that where you live and where you work has a direct effect on your access to care. And so we really want to work with our trusted community partners to be able to provide resources and information around housing, transportation, food resources, employment resources. So we partner with local banks or local employment agencies to have a job club or financial wellness classes, because we understand that all of that does impact one's healthcare. So moving on, this is really just an example of some of what a day at the Blue Door Neighborhood Center looks like. And so you can see it's, again, a combination of the programming that I referenced in our last slide. So a job club addressing our social determinants of health, a CPR 101, which would be considered like health education. And then we also offer a number of free physical activity classes on a weekly basis. So we'll have something like a Zumba or a smoking cessation class. So really trying to understand the different needs that our community is facing and trying to offer something for individuals across the spectrum of healthcare and whatever their health needs are at that moment, being able to have something for everybody. So at the moment, the Blue Door Neighborhood Center has 3 brick and mortar locations. We have one in the Pullman neighborhood, one in Morgan Park, and then our newest location is in South Lawndale. And that's where I'm the manager of health education. So this is a really great opportunity for us to, again, be in the community and understand what the community needs are so that we can develop programming around that. And really before we go and decide where a Blue Door Neighborhood Center is going to be located, we really evaluate 3 metrics. So our presence and our previous presence in the community, accessibility to our locations, and opportunity. We want to, so for presence, we want to make sure that we are a partner before going into the community, right? Because we want to be able to have existing relationships so that once we're there, you know, we're welcomed and folks know that we are there with good intentions and that we do have a history there. And then accessibility, ensuring that our locations are accessible via multiple means of transportation. So public transportation, vehicle, and walking. And then opportunity, really using a hardship index to evaluate and make sure that we are making a positive impact, or that there is an opportunity to make a positive impact on the health of the community that we'll be in. And so this is really just a picture of one of our signature block parties. And I think this really reflects our work to really be in the community, engage with community members, and make health education and health literacy accessible to the community. So most of our staff members either live or have previous work experience in the communities that we're in. And that really enables us to establish rich relationships with our members and community members. And so that really sums up my presentation for the Blue Door Neighborhood Center. Oh, and something's happening, so I'm going to stop sharing. And our efforts to be in the community and provide access to health education and health literacy in South Palmdale and throughout Chicago and the state. So thank you.
Jessica, thank you for sharing yet another incredible model of community-based healthcare. I love how you emphasize the importance of relationships, both with the patients that you're serving and in your community and being really present where people live and work, but also in the relationships with groups such as the Greater Chicago Food Depository and other local organizations. That's so important.
And makes the work easier in a sense once you're able to do that, because the community really develops a relationship with you, and there's that trust, right?
Yes, exactly. And I also loved what you said about whole person health, that oftentimes healthcare is only thought of in what we do for people who are sick, but also there's things that we can celebrate about being healthy and working towards our health, such as through a Zumba class and yoga and the classes that you offer. So thank you for the work that you do, and thank you for sharing with all of us.
Yeah, thank you for the opportunity to speak.
Yeah, absolutely. And next I'd like to introduce Elisa and David, who are your local Cigna Medicare advisors.
Hello, I'm David Thompson, and that's Elisa, obviously. And just to reiterate, we do have 3 essential opportunities for those either on Medicare or close to being eligible for Medicare. And Healthier Together is a health and wellness educational series that we have available. Our Benefits Checkup is an online tool which helps identify the local public and private programs for which you may qualify, and assistance programs include medication, healthcare, food, nutrition, transportation, tax relief, veteran services, and so much more. And go on, Alyssa.
And what's really good with our program, again, I'm Elisa Rios, our benefit checkup, where actually you could get paid to have these checkups. Like, for example, let's say your yearly 360 exam, like if you do it every year, you get gift cards, like a $50 gift card. If you do the diabetes for the eye exam, you'll get like $15 gift card. The mammogram, again, these are all gifts. When you actually go and do your physicals, you're actually getting a bonus to do them. So that way you could keep yourself healthy and do all your routines. And also what's really important is we do this Healthier Together seminars. Right now there's actually 6 of us in Illinois. And what we do is these seminars where they take place once a month, and you get educated about diabetes, let's say practical nutritionists, fall preventions, and much more. So it's very important that they get educated on all this stuff, and especially in depression, we also focus on that. So they're also free. There will be online, of course, seminars, because we can't do them live anymore. We used to go do them in public places where people could come in and actually see them live and ask the questions live. Now, we're a little bit put to the corner, but we still do them on Zoom. And also, if they cannot get on Zoom, they could at least hear it through the phone, because they could connect through the phone and listen to our presentations. And then David, what else you want to say?
I think that about covers all that we have to offer. The one thing I want to emphasize also is all these programs and services are available to anybody that, again, is Medicare eligible or close to being Medicare eligible, and all are at no cost.
And the last but not least, if they need help in guiding to apply for extra help, the low income subsidy for your prescription, we also could help you on it. It's completely free, no obligation. And we could help them fill out the application for them. So we want to thank you for giving us the opportunity for speaking for us, Cigna. Again, I'm Elisa Rios and David Thompson, and Shannon, thank you for all your help, and we appreciate, and Jessica, we met you, and Marta, we met you, so good luck to everyone, and hope to see all of you soon.
Yes, thank you for sharing. And I'm glad that we'll have a little bit more time to dive into more details about all of the work that you're doing with our question and answer session. And David and Elisa, I want to also thank you for being in the community, demystifying Medicare. It's such a robust program with so many parts to it. And you are helping people understand all that's available to them, and encouraging them to learn more through the incentives and the gift cards and the free seminars. So thank you for the work that you're doing and helping our Medicare population.
Thank you, Shannon.
You're welcome. Thank you.
I'd like to start now with our question and answer session. And let's start off with a question for everybody. We've spent our time thus far today talking about barriers to care faced by the Puerto Rican and Latinx communities. And our COVID-19 pandemic has really amplified some of those challenges. You each bring such a unique perspective to this conversation from different parts of the healthcare industry. And I'm curious what impacts you've seen in the work that you do where COVID-19 has had an impact on this population. So I'm curious to hear from each of you. If it's all right, let's start with David, then Elisa, then Jessica, and then we'll end with Marta.
Well, one of the ways that Cigna has made it more accessible for more people is that now we have direct links that you can get onto and have personal contact with a representative. For those who have the ability to work the internet, we also have online telephone applications that people can go through that we can walk them through. And like Elisa was talking about the extra help, another thing we can do is we can do that all over the phone. We get on with Social Security and do all the work for them. We just need to talk to them on the phone. So they don't need to be seen. We just need to talk to them and ask them some questions and get that going. And we're well versed in helping people apply for extra help that can give people a great deal more benefit than they currently have.
And then also what like to mention is since once they have their Medicare Part A and B, we could help them also with the Part C and D, which is a Medicare Advantage plan, which also will provide for them and no cost, and will give them dental, vision, hearing aids, over-the-counter prescription and no cost to them, which will be mailed to them once they choose, they order it and it's mailed to them. We also provide the gym, okay, which is very, very important, that they go out and do like Zumba classes and join. We have a personal trainer once a week for 52 weeks that would help them get healthier in their life. So it's important, those little things that they're not aware of, and a lot more that is no cost to them with a Medicare Advantage plan.
Well, I think the pandemic has really brought our social and racial inequities to the forefront of public health. And, numerous barriers have been brought to light. To name a few: transportation, digital divide, economic, right? So I think for sake of time, I can speak to the digital divide. and how that ties into social isolation. I think a lot of our communities maybe weren't equipped for to get online. I know we all pivoted to everything virtual, but we really, at one point, I think all had to step back and say, can people even access this? Okay, we've now transported our information online, but is it accessible? And so it's great to hear, David mentioned you can get on the phone and do a wellness call, right? Or walk people through how to access a service. And so that was definitely something that we also had to do, is step back and say, hey, we have to spend a little more time showing people how to create an email address or how to access programs online, because we were depending on this virtual, or we still are depending on this virtual platform for a lot of our social interactions and to access a lot of the resources that became available to us. So yeah, I'll say the digital divide has been one of the largest, and I'm glad that we're all taking the time, that we acknowledge that it is a divide and that we all have taken steps to meet individuals where they are. I'll end on a positive note though, and I'll say another thing that I noticed myself is during the pandemic, organizations, there was the spirit to really work together and come together and combine our resources. And I thought that was very beautiful to see communities and organizations across spectrums and silos come together and really mobilize to help the community members.
Mm-hmm. Okay, for the pandemic, for us in particular with our home health work, our home health nurses kept taking care of COVID-19 patients. That's super important because there were a number of home health agencies who would not do so. They just made sure they had the adequate protection. And so that what that meant was they were monitoring their temperature, their blood pressure, their oxygen level, their weight, and all of that was important because when they hit a certain point, we knew that perhaps their oxygen level had dropped and they needed to go into the hospital. So to have Latina and particularly Puerto Rican nurses doing that care helped a lot of people to not, have to go into the hospital, or they were provided the care they needed to prevent the worsening of their condition. So that's number one. Number two, we became a member of the Illinois Unidos coalition. And the reason the coalition formed is because our Latino community was dying at a larger rate than other ethnic groups. And so our doctors and nurses and researchers said, what's going on is particularly Marta del Rios, Puerto Rican physician in the emergency department at UIC, was like, why am I seeing so many of my people in this emergency room in such bad shape and dying from COVID? So we began to mobilize and to work with our city elected officials and to make sure that we moved more of the COVID testing into our communities, and people who could speak Spanish do the contact tracing. And even recently, we had to mobilize to make sure that our communities actually were getting access to the vaccines. So this is something that just kind of happened. This was our having conversations with the mayor, the governor, with Cook County, and saying you're missing Belmont Cragen, you're missing Brighton Park. We have to have teams getting to them, conducting surveys. ASI conducted surveys of our workforce about the vaccine and their hesitancy about that. You have to mobilize those resources into the community with partnerships, and that has been helping to improve the number of people vaccinated in our communities. But that's something we did in reaction to the fact that our elderly population was really getting hit the hardest, especially in nursing homes and senior housing. And so we had to work together to mobilize to change where the resources were going to address it.
Yeah, thank you all for sharing your observations. And Marta, you touched on such an important part of making sure that information is being shared across neighborhoods and in the communities, and addressing topics such as hesitancy, really hearing what people have to say, what's on their minds, and meeting them where they're at. Thank you all for that, for your observations. My next question is going to be for Marta. We talked a little bit earlier about the linguistic and cultural barriers that Puerto Rican and Latinx communities may have with receiving care. I'm curious what advice or recommendations you have for healthcare organizations to improve their cultural sensitivity and build some trust with these communities.
Well, one thing that is important is to go where our community is. So when the pandemic hit, we were in food pantries, churches, out wherever our community was to get them information, food, and other resources. So I highly recommend getting out into where a community is. And we actually have, I think, 5 churches we're partnered with now. Go to those block parties, go to their events, but partnerships are really important. Regarding the linguistic question, that is so important. Our registered nurse, Diana Soto, was able to help a COVID-19 patient who was both hard of hearing and he could not speak English. So he had those 2 barriers, and he was bouncing around this hospital, not getting the care that he needed. And because thankfully she could speak sign language and Spanish, she was able to link him to the proper services and help his mother as well understand what was happening to her son. So it is a must to have clinicians who speak Spanish, or you have access to speak Spanish. There's too few people in our hospitals and other places who don't speak Spanish or don't understand different languages, and that can impact this individual, this patient, who didn't understand what was happening to him. That is not good. And so I do believe we need to increase funding, and we need to increase training for clinicians so they can speak Spanish or can have access to someone who could speak the language, so they're not mistakes in care. You can have like the wrong surgery. That happened to someone I know. She was in the surgical room, and the anesthesiologist spoke Spanish and told her the surgery she was having, and she didn't need the surgery. So it can make the difference between life and death, between good care and bad care. So definitely we need more clinicians who can speak Spanish or in other languages and understand the needs of their patients.
Yes, and that sounds like such a skilled nurse that you shared about being able to speak in so many different languages, including sign language. So props to her, and I hope that she continues to do amazing patient care. My next question is for Elisa and David. We know that preventative care can be a great way for folks to avoid a condition getting worse or even happening altogether. What are some of the ways that you work with your advisees in encouraging things like health screenings, regular checkups, and other types of preventative and wellness care?
Sure. Well, one of the things that all of our members have access to is they have access to nurses and doctors 24 hours a day, 7 days a week, 365 days a year. They could just pick up the phone and have access to somebody. So if they have questions about their health, they can always speak to somebody in both English and Spanish. So everybody can, from the comfort of their home, can just ask questions that maybe they'd be reluctant to do anything with above and beyond it, like going out to see somebody perhaps. And then the other thing is, again, our health, on the Cigna website, Cigna Medicare website, there's ongoing Healthier Together programs going on, like with the topics of pneumonia, diabetes, high blood pressure, things like that, where they can just get educated. Like Elisa said, you can just pick up the phone and call a toll-free number and listen in, or if you're good on the computer, you can access the slides that will be presented as well. And you can do that. You can also do that 24 hours a day, 7 days a week.
Yes, we like also David mentioned, we also have that 24-hour nurse line. So any questions or anything before even going to the emergency room or going to any hospital right now, you could call the nurse and actually describe what you're feeling or what's going on, and they could answer you before you even attempt to go to an emergency room. So we have all stuff that you could call in, or you could actually go on the website. So we have that 24-hour nurse line, which is excellent.
Yes, all great options. And I like that you highlighted the availability of a phone line addressing the digital divide that Jessica brought up earlier, that we live in such a digital world right now, but it's such a privilege to be able to access information digitally. And I'm very thankful that you've thought of different channels that patients can engage with to get the information that they need.
And they could also, Jessica, I'm sorry, Shannon, they could also, there's certain languages that they could, like Martha mentioned about, a lot of them don't speak the language. Myself, like I speak Spanish and my mom don't speak English, okay? So it's you could actually, on the phone, they'll tell you press 1 for English, press 2 for Spanish, and they also have translators on all other languages. It's not only English and Spanish. So we do have translator that could help them access any questions that they need for their health.
That's great and so important. Again, making information accessible in more ways than one. So thank you for sharing that.
Thank you.
My next question is for Jessica. There's this common saying that we don't know what we don't know. And as a health educator, I'm curious to learn more about your experience making education available in the community. What are some of the common themes that you see with where we need more education and topics that need to get addressed more in the community?
Yeah, that's a wonderful question. And a lot of folks have mentioned, I think some of the items that I'll talk about. So I think first is healthcare system navigation. The healthcare system can be very cumbersome and intimidating to folks, especially if you're unfamiliar with how it works, if it's your first time engaging with it, or if everything is in a language that is not your primary language. So I think there is still a lot of work to be done around healthcare system navigation. And then I think the pandemic, secondly, has really brought to light that a lot of people are not engaged in primary care. And somebody had a statistic during there, I think it may have been Marta, regarding number of or percentage of folks that don't have a primary care provider. And so I think there is still a lot of work to do around educating all communities of the importance of primary care. And when you can utilize that versus an emergency room or something like that, and the importance of establishing like a medical home so that you have a provider or physician that follows you through years and really understands your background and your history so that they can provide that care. And lastly, I think I referenced this during my presentation, is really being able to adapt like federal guidelines, like federal health guidelines, into something that our community understands and is going to be receptive to, right? So first, all of that material is not available in multiple languages all of the time. But then we also have to take into consideration the reading level of the community that we're presenting to and the cultural language, right? So being, if somebody says like, stop drinking soda, maybe I'll say we should limit our Umix or Fanta consumption, right? Because that is something that my community that resonates with my community, and they will pick up and be more engaged in that. So I think also learning how to adapt that information to something that is more relevant for our community.
That's so important. Thank you for highlighting reading level too. We've talked about access to information. We've talked about languages, but I'm really thankful you brought up reading level as well as something we should be considering when working with the community. As we near the end of our hour, I'm going to do one last question, and I'd like for each of you to take a turn answering it. And it's in the spirit of the Puerto Rican Health Summit and the Puerto Rican Agenda, where we'll want to compile action plans and solutions to address some of the barriers we've discussed today. So in that spirit of offering a recommendation, if you could do one thing today that addresses a barrier to care and advances health equity, what would it be? So let's start with Elisa, and then David, and then Marta, and we'll close with Jessica.
One thing I think I would address would be, I understand because of the reading barrier and stuff, but they do have families that could help them get this information. I think by everyone here, because it's with the health industry, I think we all should at least help the elders by giving them more information. Like Marta said, be more in local places like the pantries, we do that, the churches and stuff like that. By giving more information, they could address more things that they need, and then maybe start asking more questions. Because I think they're more afraid because of the language barrier. So by myself, like myself, I speak the Spanish, and I think when I start speaking to them in Spanish, they get really, really comfortable, and then they start asking questions. So I think it's just going out there and reaching out to them.
One of the things I would say is that some people may have some hesitation because of cost, but we've mentioned it before, but we offer all of our programs at no cost to the beneficiary. And our goal is always to help everybody live a healthier lifestyle and be your trusted advisors. So they can always pick up. I don't speak any Spanish, but again, I kind of like Elisa said, I can get a translator on the phone in 30 seconds that can help me to I was just talking to a guy last week that speaks Arabic. I don't speak a word of Arabic, but I had an advisor, a translator on the phone with me doing a three-way call. So don't ever let anything like that stop you. And we are getting more and more. We have representatives within Cigna that are out in the community on a daily basis. That's their job duties. And so we are also outreaching in the community, and programs like this really help us get the word up to other people to access this calls and ask us questions.
I would continue to advocate for increased funding for promotores de salud. The Mayor Carmen Yolin, the former mayor of San Juan, was talking about a new model of care similar to promotores de salud that she's piloting in Puerto Rico for our Puerto Rican elderly. And so programs like our current promotores de salud or new models of care where you have more people in the community who can speak the language, who can help cross those literacy barriers and immediately get emergency assistance or assistance that's needed right now, that's really critically important. I did want to say also, there are two quick ones, that for us in our world, we're very pleased that our President Biden is working on a bill to increase the pay for home care. Home care really was the savior of the pandemic. When the pandemic hit, you couldn't go to your hospitals, you couldn't go to your clinics, you were at home, and if you didn't know how to understand how to use a tablet, you were in big trouble to connect with care. So he's promoting increasing pay, and also we're working to increase payments to telehealth, so for home health agencies, so we can provide this needed assistance right in the home, tracking vital signs and keeping people healthier where they should be in their home, the safest place for care. So those would be my recommendations.
Yeah, my recommendation would be to continue the work around social determinants of health and how they impact our everyday health. As I mentioned, the pandemic really brought to light a lot of the disparities that existed in our communities. And so there is a lot of momentum right now around addressing social determinants of health. And I think we should ride that train and really continue to provide those assessments, that linkage, because again, it's whole person health. It's not just accessing a physician, but it's getting to the physician, being able to eat healthy food when you get home, having a home, a stable house, right? So continuing the work around social determinants of health.
Yes, what each of you brought up is so important. And I want to thank you all for the insights that you shared, the ideas that you have, the solutions that you proposed. The work that each of you do is so important for not just for our Puerto Rican and Latinx communities, but for all communities in promoting healthy living. And a lot of you mentioned this while you spoke, but healthy living isn't just treatment when we're sick. It's feeling empowered. It's feeling connected. It's celebration of life and vitality. So I want to thank you for all of the perspectives you offered. It's been such a joy speaking with you and learning from you. And I love getting to watch each of you share, and folks around the room nodding along like, yes. It's such a celebration of life. And I'm just very grateful to have the opportunity to speak with you all. So thank you. And I hope that everyone watching has found this time as valuable as I have.
Thank you, Shannon. Have a great day.
Thank you.
Thank you, Shannon.
You're welcome. My pleasure.